Kendra, I'm getting a headache. I think I'm gonna go and get an aspirin. I'll be back in just a minute.
Okay.
Whoa, I feel a little dizzy here. Something's wrong about my vision. It's a little blurry on me. And somebody's at the door. I hear the doorbell.
I think you might need to sit down. It sounds like your blood pressure may be a little high.
Oh.
I'm gonna check it for you. Let me see your arm. Wow, 165 over 100. Did you take your medicine that the doctor prescribed you?
Oh, you know, I don't like taking that medicine. I don't like putting stuff in my body I don't know about.
Well, I've got the pamphlet right here. Let's just go over it together.
Okay.
Now, it looks like here he's prescribed you some nifedipine. Now, don't be alarmed if you see it written as Procardia, because that's just the trade name. Now, it's used as a calcium channel blocker or an anti-anginal or an antihypertensive. That just means it's going to lower your blood pressure, keep you from having chest pains, and it's also sometimes used to treat Raynaud's pneumonia. Now the interactions, you gotta watch it because it interacts with beta blockers. It may increase the likelihood of you having CHF. It may increase the risk of phenytoin. Now, I know you take melatonin to try to help you sleep at night because you have a hard time, but you gotta watch it because it'll increase your blood pressure and your heart rate. And you gotta watch it with some herbals like ginkgo or ginseng or St. John's wort, because the ginkgo and ginseng will increase your plasma concentration, but the St. John's wort will decrease it.
Yeah, but I don't do that.
Okay, good. Well, you only take it by mouth. You don't take it within the first week or two following an MI. And if you use the sustained release, it helps treat the chronic hypertension. But if you stop taking it, you can't just stop automatically. You have to gradually discontinue it. You can't store it like in your car on a hot sunny day, or it's been snowing outside. You don't want to store it in extreme cold either. You want to keep it between 59 and 77 degrees. You don't want it to be next to a window or in a moist area because you want to block it from the sun. Now, there are a few side effects that come along with it, like every other drug. You can have sore throat, weakness, fever, sweating, chills, dizziness, lightheadedness. It may decrease your blood pressure too much and you'd have hypotension. You could have facial flushing. You could feel nauseous. You could have heartburn, joint stiffness, muscle cramps, nasal congestion, sexual difficulties, but the major ones are you could have a heart attack or hepatic toxicity. It may make your lab work look a little crazy because it could cause mild to moderate increase of alkaline phosphates. You probably shouldn't take it with grapefruit juice. I know you like to drink juice in the mornings, but just make sure it's not grapefruit because it can increase your plasma concentration and increase the likelihood of you having adverse.
Just grapefruit.
Yeah, adverse side effects. Now, this doesn't go for you, but one day you might want to have grandchildren, so it would affect me. It's in pregnancy category C. It is, well, it hasn't been determined really if it's safe during pregnancy, but they do know that it's distributed in breast milk to the baby, so I'm going to have to really be careful one day. Not really sure what the dosage is that your doctor has prescribed you, but it can be taken in For angina, 10 to 20 milligrams 3 times a day, up to 180. Or for hypertension, like you have, 10 to 20 milligrams a day, 3 times a day, up to 180. Or 30 to 90 milligrams sustained release. But now the availabilities, you'll have to watch it because they come in different availabilities. 10 to 20 milligram capsules, 30, 60 to 90 sustained release tablets. Now, I'm going to do a little bit of teaching, so this is the stuff you need to remember. If you ever take nitroglycerin, you need to keep a record of it and immediately report if anything funky starts happening. You need to be aware that withdrawal symptoms might occur with abrupt discontinue, so that's why you gradually wean yourself off of it. You need to inspect your gums every day to make sure that you're not getting gingival hyperplasia, which means your gums are growing too far down on your teeth. You need to, and research also shows, which this won't affect you, but if you have friends that take it and they smoke, that really decreases the efficiency of this drug. I know that was a lot of information, but are you going to start taking it now?
Yeah, you convinced me. But
Okay.
can we get back to talking about when you get pregnant?